This is Jessica DeMassa, and I am reporting from the HISA Studio here at HIC 2017. I'm with Ken. Ken, please introduce yourself for everybody.
My name is Ken Carson. I'm a medical oncologist, and I practice in the United States. And I also work at a company called Flatiron Health, where I'm a senior medical director, and I work on something we call real-world evidence generation in healthcare and in oncology care.
Okay, so break that down for me. What does real-world evidence generation mean in English?
So real-world evidence generation is taking data from the electronic health record, pooling that data, and using it to answer clinically related questions that are used then to help inform clinical care and help inform regulators.
Okay, so give me an example of the kinds of information that you're taking and the kinds of problems or questions you're trying to answer.
So some examples would be we take patient care information where we're getting information on what treatments they received, what comorbid conditions the patients may have, and pooling that data, for example, in a single disease state like melanoma, and then looking at how those patients are treated and how those treatments are influencing outcomes in the real world. This is important because clinical trials often provide a different result from what we see in the real world.
Okay, so really it's collecting data in real time as it's happening and then using that to help impact the care trajectory later, or?
Sort of. It's collecting data in real time and processing it in close to real time so that it's ready to use for research and regulatory purposes. So unfortunately, most EMRs or electronic health records are essentially like digital file cabinets. And what we're doing is processing that data so then it can be used for research.
Fantastic. So it's really taking it and activating it in a way that it hasn't been activated before.
That's a way of phrasing it.
Okay.
Right. Making it available and so it can be used for those research applications.
Fantastic. And so what kinds of outcomes are you seeing from this? What types of insights have you discovered, I guess, as a result of collecting this and being able to have access to some of those analytics, I would guess I would call them, in such short proximity to when you're collecting the data?
So some examples that we have looked at are uptake of new classes of medications like the PD-1 or PD-L1 inhibitors, which activate the immune system to fight cancer, and looking at how those are being used in diseases like lung cancer. We also are looking at linked data with genomic data sets so that we can understand how rare mutations may influence responses to specific chemotherapy or targeted therapy agents.
That's fantastic. So, I mean, this is driving towards that whole precision medicine trend that we're seeing, more or less, right?
Exactly. This is driving towards precision medicine, and in some ways I think is the critical missing link in precision medicine. Everybody says genomics, 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 that's what's going to drive cancer care, but it's really genomics linked with the longitudinal data from the EHRs that will help us determine what works in one situation and doesn't work in another.
That's fantastic. I've not heard that said that way, and I think that's well articulated. It's the longevity of that data and being able to pool it and collect it.
That's right, as opposed to just providing cross-sectional data, which ultimately is of limited value.
So what do you see for the future? I mean, this isn't such an interesting space, and it really is evolving because it is the convergence of two big trends right now. You've got the data aspect, the AI aspect, and you've got that other side of it with the genomics. So what do you see for the future for this? Where are we going to be 5 years from now?
I envision this being a major source of evidence that's going to drive regulatory decisions and clinical decisions, because when you really look at it, 90% of the questions that we could ask won't be answered by a clinical trial. Clinical trials are too slow, they're too expensive, we don't have enough patients to enroll in them.
Right.
So using this data harvested from electronic health records will answer these questions and be a major source of evidence for clinicians moving forward.
That's exciting. That's exciting. Thanks so much, Ken, for joining us and for telling us a little bit about the work that you're doing. We definitely look forward to a future that's informed with that type of data. I'm Jessica DeMassa here at the HISA Studio at HIC 2017. Thanks.